Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back. This is the second segment here. This is Living Pain-Free. I'm Dr. Thomas Grove. Dr. Marc Darrow is away from us here this week. We're talking to you about your orthopedic and musculoskeletal injuries, and how regenerative medicine might be a good option for you. Angela, I see you. Let me give you one moment here. I want to talk to you guys about giving the phone number out here so we can get some more callers. We're at 866-870-5752. That's the number to call us live here in the studio. 866-870-5752. We'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We even pay the postage for you on that one. And if you want to get a consultation with our staff over the phone for free, 800-300-9300. That's 800-300-9300. Making sure, too, you're checking out our website. Look at these studies. Look at us actually doing these procedures. Spot on every page for you to give us an email. See if we can't get you some relief. We're at www.jointrehab.com. That's www.jointrehab.com. We've got Angela coming to us from Calabasas. Angela, good morning. This is Dr. Thomas Grove. How can I help you?
Yes, I was wondering, because I know that over the age of 50, we only have less than 1% stem cell in our body, and the quality is not as good. I was wondering, why don't we use umbilical cord stem cells?
Yeah, really good question. So I'm not sure where you're getting that figure from in terms of less than 1%. So we've got stem cells all over our body. We know that there's great sources of stem cells in our body, right? It's in the adipose tissue. It's in the bone marrow, right? It lines the connective to, there's just, tons and tons of stem cells all over our body. So I wouldn't say it's necessarily true. We still get great results with patients using bone marrow. There's a lot of different ways that we can get stem cells here in the United States. Bone marrow and fat are definitely more common. Umbilical cords are something that a lot of research is being done, especially outside the United States. But yeah, age does not have a big factor on results. So we certainly get great results, people even in their 90s using things like bone marrow. So really amazing stuff that our body has. We've got this amazing ability for our body to heal using stem cells. Have you ever had a treatment before, Angela?
I'm sorry?
Have you ever had a treatment before with regenerative medicine?
I haven't had any treatments, but I made some arrangements for my family to receive umbilical cord stem cells, and they've had miraculous results.
Oh, that's awesome. What body part were they treating?
It was actually for chronic illnesses, autoimmune, and chronic fatigue.
Oh, fantastic. Yeah, it's a really exciting area of research. Again, a lot of this stuff is done outside the United States in terms of treating those sort of diseases. Nothing that we do here in the clinic in terms of treating autoimmune disease. But we know that, these are cells that are involved in that process, but nothing that we're quite doing yet. Very exciting area of research, though. So, Angela, really appreciate your call. Thank you so much for calling in. Again, a great opportunity here to talk about, what stem cells are and how these things are used to heal the body. We've got stem cells all over our body, and we know that when we inject, these, whether it's platelets or we use stem cells, really what we're doing is we're just turning on the metabolic machinery, right? Your healing stuff that you have in your body, which we know is a lot of cell-to-cell communication. So it's not like we just inject the cells and those are the only players involved, right? What happens is your body kind of gives out these little injury signals through cellular messengers that's actually going to wake up your body's what we call sleeping or nascent stem cells. These are guys that waiting at the ready, waiting to be mobilized and help heal tissue. And so what we do is, again, use some injections, create some inflammation that sets off that healing cascade. And so it's a really awesome way to turn on your body's own ability to heal, right? It's not like we're putting in some kind of foreign medication or substance to get some healing going. We're just hijacking the body's own ability to heal. Even though it's a very complicated set of cell-to-cell communication, really what we're doing is we're just supercharging your body's own ability to heal. We're taking the same cells that are involved in that process and we're concentrating them down. And then from there, this is what we call a supraphysiological amount of cells, meaning, more than what is normally there. But these are the normal cells that are involved in this communication, and that can really accelerate and get a lot more healing going for patients. So, age is a very common question that we get in terms of, am I too old for treatment? Am I too young for treatment? Are my cells still any good? And certainly, we've got tons and tons of research on this. In terms of the last decade or so, there's been some really good research looking at, what is the clinically effective amount of cells that you need. There's a really good argument for that. So the same PRP that was being used, 20 or 30 years ago, that was not very concentrated, has been shown to not be near as effective as the stuff we have today, which really just comes with technology, right? We do more studies on this stuff. The centrifuges, or the ability to harvest these cells, get more and more efficient, where we don't have to take as much blood. We can still get a lot more cells. But if someone comes in and they had failed PRP or failed stem cells or something, I always ask them, what exactly was done? Especially the PRP route. If you're getting like one vial of blood drawn and you're putting it back in, one vial of PRP, that just tells me there's not a great amount of concentration of those platelets. Even to call something PRP, you need to be in that kind of 3 times concentration, meaning 3 times the baseline number of platelets that you have, in order for you to have a clinically effective dose, right? Just like a medication, right? We need an effective dose of cells. And so that's definitely been a huge movement. A lot of studies coming out looking at, concentration of cells and making sure that we're getting enough to still be effective. And so places will use, what we call cheaper kits, or they have poor concentrating power and they don't get very good results with it. They might not get any results at all. And they come to us and, we get good results with it. And there's just a lot of different reasons why, treatment wouldn't work for somebody, but that's definitely a big one, right? If you don't have, the proper stuff, we call that, bad doctor syndrome, where we're not using, proper equipment, we're not getting a clinically effective number of cells, putting your patients in a position to succeed. Again, another really common way that we get good results is we're very strict about the aftercare instructions. So we really take time to talk to you about, okay, I come in, I have the treatment. Now, how do I optimize my recovery? How do I really maximize my results? The first thing we talk about is making sure you're limiting your activity after injections. If I'm injecting something like a knee or a hip or an ankle, I don't want you doing, 20,000 steps in that thing a day. Not the time to go on that long hike, run your 10K, run a half marathon, that kind of thing. You got to give that tissue a chance to heal, right? When we inject that tissue, you get some inflammation that sets off that healing cascade. Your body's going to start to lay down what we call immature or disorganized tissue. So it's kind of the immature version of what normal, healthy, what we call mature or organized tissue is. Again, you can look at it under a microscope and actually see the change in how the cells are involved in maturing the tissue. And that's really what we're going for, is we want to use proper healed tissue before we get you back to activity. That's a really common thing where I inject somebody 2 days later, I feel pretty good. A week later, I feel pretty good, and then they get back to doing some activity and they really limit their healing. Might actually bring back some of that pain. And those are the types of patients that typically have to keep coming back for more and more treatment. And my whole thing is I want to be efficient with your time. I want to be efficient with your money, give you the best results possible, or put you in the position to be successful. So that's a really common thing that I have to keep talking to patients about is, well, I had a couple treatments, I'm not better. And then we go into, actually I've been super active. Maybe I played 36 holes of golf, or I went on this big hiking trip, or, we got ski season coming up. So making sure that you're putting yourself in a position to be successful and allowing this stuff to work. Another big reason why we see some other places or not optimal results happen. It's just not using the ultrasound. Again, we talked about it earlier in the show here, but it's one of those skills that once you have it, you don't go back. You really understand the importance of diagnosing and the importance of the interventional component where you can actually aim with that needle. So, if you're not using that ultrasound, again, you're not really up with the times, or you don't want to invest the time into this technology that can really optimize the chance that your patients are going to get better. Also make the treatment more comfortable for the patient. So that's a pretty common one as well. We talked about NSAIDs, right? The ibuprofens, these anti-inflammatory medications. Another ones are steroids, right? Things like Kenalog or cortisone, prednisone. These are also very strong anti-inflammatory medications that we know there's a direct correlation, right? If you do a regenerative medicine treatment and you're slamming a patient with high doses of these medications, that again might help with the pain, on the front end, really limits how much healing that you get. So, really recommend patients that you stay off of those sort of medications, especially when you're going through that initial healing phase from regenerative medicine treatment. Again, I'm not demonizing any of these things. It's just, when and where to use them and how much to use. I think in our culture it's not quite, optimal for healing, right? You can certainly, take an ibuprofen. It's not going to kill you. But we don't want to, take these medications after we treat. We don't want to take these medications chronically with high doses, subjecting yourself to the side effects of it and not really having a great ability to heal because it's blocking that initial inflammation that you need to heal. I got a really fun case to talk about this week too. Very frustrating. When I get patients who, they have pain, they go to a provider and they get, suboptimal results. And this is somebody who had some knee pain, had some arthritis. They came in to their local physician, ended up getting a steroid shot, didn't help their pain at all. And they heard about us in the radio. They came in, and again, it's getting back to basics. If you got a patient who's coming in, you got to talk to them, right? You got to look at that area, right? Inspect it, and then you got to palpate it. You got to put your hands on the patient. Again, I have extra training in that ultrasound, so I can use musculoskeletal ultrasound to also help diagnose what's going on. This is somebody that, got talked into a treatment and their physician did not put hands on them. And as soon as I came in, I put my hands on the back of that knee. There's this grapefruit sitting on the back of their knee. They had something called a Baker's cyst. I don't know if you guys have ever heard of that before. But a pretty common thing that we see in the clinic, just one of those things that if you don't look at it, right, if the patient's just laying on their back and you don't feel the back of the knee and you're not looking at the back of the knee, certainly you might not find it. This is somebody that, as soon as that physical exam was done, we had an aha moment like, oh yeah, that's exactly what's going on. So with a Baker's cyst, what we can do is we can go in and drain that fluid, again, using ultrasound guidance. Very, very important now in that area that you know exactly what's going on. You don't want to bury your needle. There's something called the popliteal artery. Really, really big vessel that's on the back of the knee that's next to that Baker's cyst. So you got to make sure you're avoiding that structure. But again, very safe to use with ultrasound. So we go in, numb up the back of the knee, take that fluid off. I like to put a little PRP in there as well to try to keep that thing closed. But you can kind of think of a Baker's cyst kind of like a spillover. So there's a lot of times it communicates with the joint space, or it's connected to the regular joint space. So if you ever have water on the knee or the knee feels kind of big and swollen, a lot of times you'll get a Baker's cyst as well. And if they're big enough, you can kind of feel kind of a big bulging on the back of the knee, like this gentleman had here this week. But sometimes they're not that big, and they can still cause irritation, posteriorly or on the back side of that knee. So it's very, very important that, if you're going to somebody, you're just, you're doing a proper physical exam, you're taking a proper history, you're not getting rushed through the visit. Because this is something that, again, for me, very, very easy to see, but, was missed somewhere else. But it's a frustrating thing to hear that with patients. And so, great, we got them some relief, something like that. It's a big collection of fluid. Certainly that can limit your range of motion. And so as soon as we got that fluid off, he, stood up. He could bend his knee, full range of motion. He's like, oh my gosh, this is amazing. But it just gets back to basics, right? You got to know what you're looking for. You don't know what you don't know. So making sure that you're doing a proper physical exam and taking a look with that ultrasound, pretty hard to miss. Anyone can look at a screen and say, yeah, that's a big collection of fluid. We got to get that thing out of there. So I want to give you guys an opportunity to talk to us live here in the studio. Our number to call here, 866-870-5752. That's 866-870-5752. 5752. We'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Again, another really awesome resource, easy read, pretty quick read. You can go through, some of the research about regenerative medicine. Almost every single day I'm reading a new study that's coming out about this stuff. So it's a really exciting area of medicine that we're gaining a lot of traction, because now we've got really great level 1 randomized controlled trials in humans showing that it's effective, right? Minimally invasive, safe. It doesn't have near the complication rate of surgery does. And hopefully we can put you in a position where we can get you some relief, get some healing going, get to the bottom of your issue before you're strong-armed into a major invasive surgery. So it's a really great place to start with that book. Again, we even pay the postage for you on that one. And then we'll give you guys an opportunity as well. If you're really interested and you think, hey, I'm a good candidate, I want to take a look and maybe just get some information for a consultation, give us a call. We're at 800-300-9300. Again, a great place to start. Get a free consultation over the phone with our staff. 800-300-9300. You can also check out our website. We'll find out a little bit more about us, what we're about, what kind of things that we're doing, what sort of areas that we're treating. Again, we treat head to toe your musculoskeletal orthopedic injuries, whether it's a joint, a ligament, a tendon, a muscle, the supportive structures, connective tissue. And the beauty of using ultrasound is I can inject almost every part of the body in a safe way. Check out our website. We're at www.jointrehab.com. That's www.jointrehab.com. Just spot on every single page now for you guys to shoot us an email and get more information about what we're doing and see if we can't get you some relief. We've been talking a lot about ultrasound here this week. We had another great case of a gentleman who came in. Active guy, right? Likes to hit the gym, likes to, get his pulling workouts in, things like pull-ups and bent over rows and a lot of pulling motions. And he ended up having what we call a little trigger finger. That's something that I'm sure a lot of people have heard about before. And this is something that was really limiting his ability to exercise and work out. It's a huge staple in his life and his lifestyle. And so came in, and he was reporting that, that finger was kind of getting stuck. So think about if you grab something and that finger can get closer to the palm, I think it was in his fourth finger for this one. So the rest of his fingers, you could straighten it out, right? But that one was kind of stuck towards the palm. And then sometimes he's kind of crank that thing back and get it loosened up again. This is a pretty common problem that we see here, but it can be very debilitating, especially if you use your hands, working out, if you use it, for your job, right? A lot of manual dexterity, things like that. Can be a very debilitating problem. And when you're looking at a symptom like that, I'm telling you, man, the ultrasound is such an awesome tool. So what we do, put that ultrasound on, and we do that dynamic evaluation. And what we see is, what that tendon looks like. Again, that tendon is the kind of the attachment point that allows that finger to flex towards the palm, right? So is it a tendon issue? Could have a tear there, inflammation, could have a contracture, right, of that tissue. It could be something else adjacent to that. Maybe this guy's got an old fracture. Maybe he's got a fluid collection. Maybe he's got some other soft tissue injury going on. This was true trigger finger. So what that is you've got these little pulley systems. The way I describe this is if you have like a little rubber band around your finger. That's kind of what that pulley system looks like. They cross the joints. And what that does is it kind of tacks down and it gives a nice little area for that tendon to glide, right? So if I've got inflammation in that tendon, that can cause a little choke point, basically, where that finger tendon, that flexor, can get stuck, and that's where you get that triggering sort of phenomena, right? Where that finger gets stuck and it can't move its way out. And so if I can reproduce that, and I can actually see that pulley system, this one was called the A1 pulley. It's kind of across the main knuckles of the hand. That's a really easy way to diagnose this thing. A lot of times what we can do is, again, use regenerative medicine, use a really tiny needle, tiny little 30-gauge needle, be very specific where we're placing our product, put it directly, where that A1 pulley is, that pulley system. And then again, if they have, adjacent injuries as well, I can put some into the tendon, maybe some collateral ligaments, to help get some healing going and actually free up that trigger. So it's kind of a cool thing is, that finger was like actively triggered. We could inject it, and immediately, right, we can loosen that up for patients. And the idea is if we can get some healing going and decrease some of that inflammation, we can get that finger, gliding again. So Again, it's another really great example of, just by looking at somebody, can you tell really what's happening? Maybe yes, maybe no. But with ultrasound now, I can really be specific and dynamically test and see what that anatomy looks like. He also had a little bit of a strain of something called the palmar aponeurosis. It's kind of the deep fascia that's on the palm side of things. We see this a lot in our gripping athletes, right? So people who are doing a lot of, pull-ups or monkey bars, that kind of thing. I've seen this in a lot of gymnasts as well. They take a lot of, micro trauma to that hand. And so that's something that also could be a source of pain for somebody. So that's another, again, very important lesson that we want to treat, that whole functional unit, right? All those things that are around an area that's generating pain for somebody, because that really is going to put you in a better position to be successful. When you're looking at, pain and you've got one little spot that hurts you, you got to make sure that you're doing dynamic testing, you're doing a physical exam. Is this maybe a referred pain pattern where the pain is actually coming from somewhere else? So pain can be kind of a tough thing to tackle. And I don't know how people can do that without doing a physical exam. It's so important. You catch a lot of things that are missed otherwise by, again, getting back to the basics and taking a proper history, doing a proper hands-on physical exam. It's just one of those things that when your patients have a tough time with things and you ask them if they had a hand put on them and they say no, well, they're probably missing the core issue there, right? So it's very important that you're doing those sort of things. I got one last case to talk about here this week. Very, very interesting. So there's been a big increase as well in the typical pain medicine world for back pain. So if someone comes in with back pain, the traditional model is, maybe rest, physical therapy, maybe some medications that block that pain, decrease inflammation. You can be talked into things like nerve blocks or facet blocks, maybe epidural. And these are things that are designed to decrease inflammation and numb up the area. But none of these things really heal the tissue. I had a patient this week that had a couple of procedures called an RFA, which is a radio frequency ablation. And really what this is if you go the traditional route and you're not getting relief, the next thing they're going to want to do is do more invasive things, right? This is where you kind of zap the nerve, right, that gives you sensation of that area. So, in theory, okay, I get what they're trying to do. You've got some pain. I want to numb the area up. Medication didn't work, so let's just locally go and zap that nerve, fry the nerve that's actually responsible for giving you sensation, which certainly can get people relief. The problem with this now, okay, a lot of controversy is we're finding that as a result of zapping that nerve, you might also cause some atrophy, meaning some weakening and kind of shrinking of a muscle called the multifidus. The multifidus is a paraspinal muscle. It runs right along that spine. Very, very important now for structural stability and strength to that back. We know when that muscle gets smaller or gets something called fatty infiltration, that's directly correlated with a lot of back pain for people. And so a lot of different reasons why you could get that atrophy or fatty infiltration. And one of them is just not getting a proper nerve connection in that area as a result of this procedure, right? That can result in that muscle not being activated. And again, can make that problem worse. So I'm not a really big fan of using that kind of procedure that can put you in a position where that muscle isn't firing as much, right? So that can make back pain worse. It can make if it's a disc issue, if it's a lumbar facet, right? Those little joints that help connect the backbones. If it's one of those sort of issues, if it's an instability issue of maybe one of the supporting ligaments, right? We got a lot of patients with iliolumbar ligament or interspinous, supraspinous ligament injuries. We want to make sure that we're making that entire chain, that entire lower back strong. And so how do we do that? We want to make sure we're putting in a position where that muscle can stay engaged, stay activated. And so this is somebody who had a couple of those procedures, again, called an RFA, radio frequency ablation, and had some really great results with us. Again, the idea there is we can get some cells and try to wake up and get some rejuvenation to these tissues, right? And the multifidus is definitely one of those big ones. And so this is one of those, really frustrating positions that people can be in is like you're in back pain, I'm taking the meds, PT is not working, and all of a sudden I'm doing invasive procedures. So we'd much rather get you into the clinic, get some healing going now, see if that's a good option for you. Thank you guys so much for tuning in. We really appreciate your attention, talking about your musculoskeletal orthopedic needs. Again, that number to call for a free consultation over the phone with our staff is 800-300-9300. That's 800-300-9300. You can check out our website, reach us there. That's www.jointrehab.com. We'll see you next week.
You've been listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.